Good morning, everyone. As our days go by, we continue to be with you every day and try to update you on all the developments. We've said many times it's a very fluid situation, and it continues to be fluid. The first thing I want to talk to you about is our primary election date on May the 12th. All of you know that I was absolutely hopeful and very supportive of trying to do our election on May the 12th. Felt like that we could do it, but as we continue to go and as we continue to get closer and closer, it's ever so apparent that that's just absolutely the wrong thing to do. So today, I want everyone to know that my underlying effort, as well as my colleagues here, our great Attorney General Patrick Morrisey, our great Secretary of State Mac Warner, we all agree that what we should do is move forward and move in a way to where we're going to extend the primary election date till June the 9th, 27 days. I want everyone to always remember just one thing, and that's this. I truly support, as these gentlemen as well, the ability for all of our citizens to be able to vote, and to be able to vote in a way that they've always voted. We've voted in wartime and in peace and in absolute, tough situations and everything. We've got, especially our seniors, that value the treasure of being able to vote. And all of our people should take an additional advice from our seniors, because I'm sure we all value it, but we oftentimes take for granted. The privilege of voting is unbelievable, and we should always remember that. But our seniors, for our seniors that have had the opportunity to be able to come and to vote and to come to the polling, to our polling places and be able to do so, I'm very, very hopeful by extending, they'll still have the opportunity to do just that. We're still going to proceed ahead, with our absentee ballots. We're going to move the dates up on a proportionate basis and all that, in a correct format in every way. But at the end of the day, I want this to be the biggest turnout of all time, because all of us should treasure the opportunity and the privilege to vote, and I want us to just have that opportunity, and by moving this, it will give us a lot better chance to do so. Every one of us saw last night our president come out with a very, very glim report, and that was that there could be a possibility of losing 240,000 people in this country. Well, we've got a long ways to go. Let's hope and pray in every way, shape, form, and fashion this wind some way blows around West Virginia. But at the same time, we've got to know we're the most exposed state, the highest risk state, and from all that, there is no question moving this date's the right thing to do. I've asked our medical experts, because I've been bombarded with basically requests to extend the date. And I asked my medical experts just this question, just this simple. And that was, based on where we are today with this COVID-19 virus, by May the 12th, can the people of West Virginia safely vote in a primary election at their polling place? Because I think that's really, really important. And the answer was unequivocally no. So today, after working closely with these two wonderful gentlemen that are on my right and my left, we are announcing this 27-day delay in our election. The new primary date will be Tuesday, June the 9th, 2020. Now the reason for June the 9th, it's the first Tuesday after all schools will be officially closed. Now, I'll get to that in just one second, because I am still very, very hopeful that at some point in time our kids and our teachers can go back to school, and I'll touch on that in just one second. But as President Trump has already said, we're at war with this virus. So we want to ensure that our citizens have the opportunity. I will always support West Virginia's voting in every way, shape, form, or fashion, and forgive me for saying that again, but you are welcome to vote by absentee, but I want all West Virginians to have that opportunity to go to a polling place that they're used to going to and that they treasure and they want to do that. You know, like I said before, I hope it's the largest turnout ever, and so officially today we're going to delay 27 days, and we're going to go on June the 9th. And I also said that ensures us that some of the schools, their last day is June the 6th, and some of the schools are out earlier, you know, whether it be earlier days of June or maybe even the last days of May. But June the 6th ensures us that all the schools will be closed from the standpoint of students going to the schools. And so with going June the 9th, that gives us a nice little buffer right there, and that's good there too. You know, I also met today with our Superintendent Birch and Clayton, and that we've been in contact nearly every day. And in following the president's lead of closure till the end of April, there's some uncertainty with our April 20th date. So today I'm going to extend that date to coincide with the president's date of April the 30th. Again, I think Clayton and I both would tell you that we are very, very hopeful to be able to go back to school. I think if we were only to be able to go back to school for 2 or 3 weeks, it would give a great opportunity of closure. It would give a great opportunity to give instruction for the summer, so many different things for our kids and our teachers. It would still be very beneficial to have the opportunity to go back, and I'm very hopeful that we're going to be able to do that. Just 2 or 3 other little things and cleaning up, and they surely aren't little things. I mean, like I said, this job at times can get pretty daggum lonely, but at the same time, it's my responsibility, and I am very, very honored to fulfill this, and we're going to continue to try to make the right decisions every day. West Virginia is still holding, if you look at the gross of all the days and everything, right around 4%. Yesterday, we jumped 29 positive cases to 191 total positive cases in West Virginia. And with that, on just yesterday's testing, we jumped to 6.7%, which was significantly higher than where we've been trending at that 4. Now, you got to always remember one thing that is, should always be taken into account, and Dr. Marsh said this the other day, but we are only testing the people that we feel like have a potential of having a problem and being positive. We're not just testing a big sector of people and everything. And so in that, really and truly, our number should be trending toward the higher side, and the higher side is a national average of probably 8 to 10%, with New York City trending at 30 to 50%. So when we're trending at 4, it's tremendous news. But remember, yesterday we trended at 6.7% just for yesterday. But we always want to keep our eye right on the ball and keep on top of this and watching. Again, going back to what our president said, last night, the next couple of weeks, he says, are really going to be pivotal, and they're really going to be tough weeks for America, period. If you'll watch the death count, in almost every 2 or 3 hours, we lose an airliner. We lose an absolute capacity of a typical airliner of almost 200 people every 2 or 3 hours. It's really tragic what is happening in every way. But our power always comes back to just one thing. President's lead medical person, a lady, spoke last night, and forgive me because I can't recall her name, But she spoke last night to just say just this, that she said, when it boils right down to it, what gives us the ability to break this cycle and to gives us safety is our behavior. Just our behavior. Our behavior is our power. Our behavior to wash our hands, keep our hands away from our face, to absolutely not congregate in crowds, absolutely stay home. It's working in West Virginia. You've got to stay that course. This is absolutely a terrible, terrible disease. And in all honesty, if it jumps on West Virginia with our elderly people and all of our vulnerability to our chronic illnesses and everything, it will be really bad. And so I tell you just to take heed to all the warnings, stay the course. We got a next couple of really tough weeks coming on. Say a lot of prayers for all those that are out there hurting in every way. We've already lost one too many people, and we've only lost one. But let's keep going at it just that way. Now, I wish to goodness that I could have reported this in a way that I would have loved to have reported this, because this is news, and it's news of how our state was doing and where we were going. You know, at one point in time, after the first 2 months of the year, and this is just a quick revenue report, but after the first 2 months of the year, we were $49-point-something million in the hole. And since that time, then there was a lot of discussion about making, mid-year or budget cuts at that point in time, and basically having to go in and lay people off, cut people's benefits, whatever it may be. And there was a big discussion about that we really needed to move on that and move on that right then. And we chose not to do that. And when we chose not to do that, we even drew a little bit of criticism about not doing it. But as we've made our way, we just kind of plodded along, and we cut into that 49 million, and we cut into the 49, and we cut into the 49. And now March, at a time when the whole world's blowing up, now March just came in at 12.3 million above estimate. And if that's not good enough, we are 99.8% of the year-to-date estimate at this time, and now we have whittled that 49 million down to 6.4 million shortfall, and we had April, May, and June to go, and we really felt like we were just moving right into surplus again, and so I commend all the people that put in all the licks, especially all those people, from our Secretary Dave Hardy and all the people that are in our Department of Revenue. But it's been a battle, economically back and everything, but this was really good news, and I wish we could have reported it as the headline news. The last thing I'll say to you is just this, today is Census Day. You'll be receiving stuff in the mail and everything, and I ask you, please, please, please make all the reports and be counted, because we need every single West Virginian counted. Again, you'll see it up on the screen, and how you can do, what you should get, and if you haven't, please place this call and everything and be counted. Stand up for West Virginia, because it'll bring a lot of extra federal dollars to us, and we surely need that going forward. But again, stay the course, stay home as much as possible. Thank you to all the employers that are working with all the people and everything. I know it's tough on everybody. It's really tough on everybody. But again, I thank you for all you've done. I commend you. You're doing good. We're winning this battle right now, but it's a tough one, really tough. So hang in there and do the best you can do. Thank you now.
Thank you, Governor. We're now going to take comments from some of our panel members. Up first, Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and it's wonderful to be with people today. I think that what the governor said and what the president and what Dr. Birx and Dr. Fauci said last night should give us pause, but it shouldn't surprise us. we've talked the whole time that we have gone through our own preparations about the power that we have. This is a pandemic. We know that the pandemic means that this virus is everywhere in the world. And the places that have made the hard decisions, that have come together as a community and have taken individual responsibility for their own behaviors to protect themselves, protect their families, protect their communities, protect their healthcare workers, have done much better than the places that haven't. We have understood and talked about the compounding ability of the virus, how a single virally infected person, if left undetected and untreated, can in 2 months infect 1,000 new people, in 4 months affect 1 million new people, and in 6 months affect 1 billion new people. We know that there are people around the world that have spread the virus in this way. We also know that if multiple people become infected and then there's no restriction in the person-to-person connection, then a whole community can get infected very quickly. And we've seen that in countries like Italy, and we're seeing that in cities like New York. We also know from last night that there are models out there, and the model that's been the most referred to is the one that comes from the University of Washington, that the projections now look like that in the next several weeks, there may be a number of other cities that start to have the surge happen to them. And the projection is then over the next weeks to months that we may lose a lot of Americans. We may lose, per this model in at the University of Washington, about 100,000 Americans in the next several months. Dr. Fauci and Dr. Birx last night are worried that it may be even more. These things aren't really surprising to us because we know this virus thrives on person-to-person spread. We know that using our own power, and that's cooperative power of social distancing, staying 6 feet away from other people, because the droplets of the virus, if somebody coughs or sneezes, can't get on you at that level. And certainly staying at home, and the governor made his stay-at-home policy, is a critical factor. We know that New York City and San Francisco had the same number of COVID positive people on March 19th. San Francisco went on a stay-at-home policy and New York didn't. And 6 days later, San Francisco had 1,000 positive cases and New York City had 15,000 positive cases. We are doing that. We know that the virus spreads by droplet mostly. We know it can live for a prolonged period of time on substances like cardboard, like stainless steel, like plastic, and that we know that we can't necessarily clean everything and get away from the virus by not having it around us. We know that we can use our power to prevent that virus from getting access to us by washing our hands 20 seconds with soap and water, with using sanitizer, with making sure we don't touch our face. Many people are asking today, should I wear a mask? Because the CDC says maybe that's important. And I think it's clear from the medical experience that people have had that wearing a mask is really not there to keep you from getting infected through somebody coughing or sneezing. It's really there to help keep you from touching your nose and your mouth with your hands, because the virus hibernates on surfaces, and when it gets into your nose or your mouth, it then starts to amplify and replicate. And we know that that's the way most likely that people are generally infected by this virus. And a study from Iceland recently showed us that half the people that had the virus didn't know it. So people without symptoms can spread the virus too. So we are using our power. We're changing our curve. If you look at the University of Washington's data over the last several days, all of our numbers are getting better, because these models are only as good as the information, up-to-date information that's fed into them. So indeed, in West Virginia, we have the ability to write our story. We have control. It's on us. And if we keep doing what we're doing, and we even double down to make sure our neighbors are doing the same thing, protecting themselves, protecting their families, protecting their communities, and we protect our healthcare workers and we don't let things surge, Then over time, because right now we're projected in May 2nd to have our surge, and we're projected to lose 500 or so West Virginians. That number continues to go down. The projection for the number of ICU beds we need is going down. So by doing the right thing, by using our power, we are changing the model, and the model will continue to change in a good way for us if we keep doing this. So I would second the governor's comments. This is a very serious time. We pray and send love and send our best wishes to people in this country that are suffering. I send it personally to the healthcare workers as well as all the citizens, because there's so many people that are doing amazingly courageous things to risk their lives to save other people. But if we follow simple rules, stay in your house, stay distant from one another, wash your hands. If you touch anything outside or bring something in from outside, wash your hands. Don't touch your face, don't touch your mouth, don't touch your nose. And if we do that well, we will continue to flatten the curve, protect each other, and make sure that we lose no more West Virginians. And I say that in an aspirational way, because the truth is that nobody gets a free ticket from this virus, and we're going to lose likely some more people. But if we do the right things, we will minimize that, and we will be the beacon for the United States. And I really thank you and thank the governor for giving me the opportunity to serve and to try to do what I can, and with this great group of people that we're working with, what we can to do the things that give West Virginia the best possible future and protect our citizens today. Thank you.
Thank you, Dr. Marsh. We'll now go to Major General Hoyer with the West Virginia National Guard.
Good morning. Today we have 400 National Guardsmen on duty. That's an increase of over 30 from yesterday. I'd like to highlight a couple of key things that we're doing and reinforce some of the items that the governor and Dr. Marsh have highlighted. One of the key things that's now happening is we have a task force that is working with over 200 different retailers, food establishments, and convenience stores to provide training on decontamination of cargo and packaging as it comes in. Again, going to the point that the governor and Dr. Marsh made, more attempt to do things such as sanitation to help flatten our curve and limit the spread of the virus, as Dr. Marsh and Dr. Schlemp continue to reinforce to us. In addition to that, we've increased testing support at drive-through sites to continue to help expand the testing capability. We're going to work on a pilot project with West Virginia University and Marshall University Telemedicine to use some National Guard equipment to be able to do additional telemedicine in underserved areas where broadband may not be prevalent or available. We continue to work the movement of supplies. Today, distribution will go out to all 55 counties from the items that have come in from the national stockpile, and at Governor Justice's direction, our task force sustainment continues to try to source additional supplies globally where they are potentially available. In addition to that, working with Dr. Schlemp and her team, in the last 24 hours, our support to the 7 epidemiology initiatives have conducted over 308 engagements to help with the contact tracing and the other things needed by Dr. Schlemp and her team to continue to help address those things to reduce the spread of the virus. Again, on behalf of all the members of the National Guard, our brothers and sisters in the first responder and the law enforcement community, and those healthcare workers on the front lines, we ask that you continue. Those of you who are doing the right things and working through that, we appreciate your efforts. And for those who are not fully engaged yet, we ask all West Virginians to be engaged in helping stop the spread of this virus. Thank you.
Thank you, General. Up next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Schlemp.
Thank you. Good morning. I had several questions from our providers out there. I want to make a quick announcement that CMS yesterday announced some sweeping regulatory changes to help healthcare systems in states address the upcoming surge. In West Virginia, again, as the governor mentioned and as Clay mentioned, we're hoping our surge is low. but we need to prepare for a surge of some sort in the coming weeks. The regulatory relaxation by the federal government included allowing hospitals to increase capacity, rapidly expanding the healthcare workforce, putting patients over paperwork, and further promoting telehealth through relaxation of those requirements for Medicare patients. We are also in the state stepping up our efforts to look at alternative care settings or alternative care sites. We're looking at hospitals in Charleston and Fairmont. The St. Francis Hospital is part of the Thomas Health System, and Fairmont Regional Medical Center that recently closed. We're also working with nursing homes in terms of trying to determine some alternatives there for placement. So we're planning ahead for a surge. We hope that's small. And if everyone in the state continues doing it now, we believe it will be small. Nevertheless, we're planning for the worst and hope that doesn't happen. Kathy?
Sure. Good morning. I think I'd ask to speak a little bit to the data, and I think we need to. Data is critical, obviously, and very important as we move forward for a variety of reasons. But I also think that we need to make sure that we don't focus on the numbers to the exclusion of the behaviors that we're talking about, because we do know that the virus is all around us, and that we can have asymptomatic spread. And so that we do need to really adhere to those behaviors that we talked about, Dr. Birx and the governor and others have talked about, to really make the ability, that's our power to create a changing situation here, that we keep it manageable. So speaking to the data a little bit, there's two kinds of data. There's the real-time tracking data that you all are following, and then there's the analysis of behind-the-scenes data that can really help us guide our actions moving forward. And so those are a little bit different focuses. We are hearing a lot of interest in hospitalization data. We hear that. We also agree it's really important. There are a couple of ways we are getting that, and we will be sharing it with you as soon as it's available to do so. Just to briefly summarize the cases that we have to date, we are seeing about a 55% female, 45% male ratio for gender. About 95% of our cases are over the age of 20, 40% are over the age of 60. So again, majority in adults. The testing, we've tested probably over 4,500 patients across the state, and the testing has been across the lifespan of adults. The bulk of our testing is in adults, but it's across all age groups. We continue to work with the lab testing arena with new technologies to be able to, we're beginning to see some influx of some of the rapid testing very slowly coming into the state, but we're working to expand that as fast as we can to use for a variety of really high priority areas, which include case and outbreak investigation, healthcare worker and other essential service personnel, and then high risk urgent clinical situations where you need a rapid turnaround time. So all of those are underway and active. We really appreciate everyone's participation in really sourcing products with us, the guards for work in our EPI investigations, and in our PPE requirement and distribution. We've got folks actively over there right now packing and shipping up together with the guard. And then finally, I just highlight there are some new available guidances on the website that may be relevant for folks at the moment. There is a new public guidance on persons experiencing homelessness. There are also protective guidances for non-healthcare settings. So that would be a lot of the essential service workers and others that are in communities doing essential services. And then under, I'll highlight too, since we had dialogue recently around hotels, motels, and lodging, that there is guidance under the business section for hotels as well. I'm going to stop there and move open to questions.
Thank you, Dr. Slimp. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. To media members, when we call on you, please remember to unmute the microphone on your end before asking your question. Please confirm your name and affiliation as well. The first questioner today will be Brad McElhenney with West Virginia Metro News.
Hi, Governor. Can you provide more detail about the election plan? Is the plan with the absentee ballots roughly the same as described before? And is there leeway if West Virginia still has an outbreak situation at the June 9th date? is there leeway to again extend?
Well, I think I'm going to pass to Mike and to Patrick. You know, as far as they can probably answer this better than I.
I'll say that this is Mac Warner, Secretary of State. The first message is we've got this, and I'm saying that we collectively, with the executive leadership that you're seeing here, with the governor and the various secretaries, we being the legislative. Last night, in fact, you, Brad, reported that there was a coalescing of minds with Miley and Carmichael, so both political parties around this. But the real shout out goes to the clerks. The clerks understand across the state. We've been in contact with them constantly this week. I was on the phone with them this morning. I'll be on the phone with them again this afternoon. And the real shout out goes to there. They have raised the questions appropriately about the election and how we're going to execute this. But everybody's in this together to make sure that this election is run safely, with the utmost concern towards the health data that now the doctors have reported to us that we'll be peaking about the time of the original primary was scheduled. So the governor has made the correct call to postpone this, and now it's a matter of working out the details. Could it be delayed again? There are a number of pressing concerns to get this election held. I can go into those details later, but the main point is the ability to do so, I think, rests, and the Attorney General has advised that it can. But I think we need to get this election over with in June, and as the governor said, keeping those options open so people can vote as they have in the past. But we have opened up this opportunity for absentee ballots for anybody in the state that is concerned about the virus, that they can vote the absentee process. Thank you.
Thank you very much, Secretary of State Warner. I would add that the governor's declaration is really focused on protecting the health and safety of citizens and also the workers, because he's trying to limit their exposure to the virus, and that's based upon the best medical information that's available. Now, the governor does have the emergency powers to allow him to move this election date because he's trying to protect the public health. And I think it's important for everyone out there to know that there are real significant constitutional issues at stake, because one of the most cherished liberties that we have in our country is the right to vote. And by moving the date, you're not only going to be able to take advantage of the changes in the absentee side, which expand the number of people who could participate, you're going to potentially enlarge the number of people who can participate in person. That's critically important to protect and defend West Virginians' constitutional rights. So I wanted to add that because I think we're going to get some questions on it.
Okay, thank you, Brad. Up next, we'll go to Kenny Bass with WCHS.
Hi, thank you. This is Kenny Bass with Channel 8 and Fox 11 in Charleston. We are continuing to get massive messages and calls and complaints about West Virginia workforce. And I know you've addressed it and said they're handling an inordinate amount of claims and claim requests. But since we last talked about it, and since you guys talked about your numbers of 150 people working on it 24 hours a day, and you're trying to increase bandwidth, what has actually been accomplished to open up the process more? Have you put more people on it? Have you been able to technically increase bandwidth? And if not, what is the timetable for opening that faucet more so people aren't getting phones which aren't answered and computers which are crashing?
Well, Kenny, I can say I think I'm reporting this correctly because Brian Abraham is here, and maybe Brian can come up and add a little bit more to this. But I think he's saying that 90,000 claims have been filed at this point in time, and we're processing those claims. And we processed them all? I mean, we're processing them. We've absolutely added all kinds more people. We've dropped many of the regulations to be able to move them quickly and everything. But Brian, come on up here and you, I mean.
That's correct. We've been in contact with them. They've had some system difficulties given a large number of claims, but they are working it every day. They've tried to add additional resources, and we have advised them that we will provide additional resources if they need it. So they're currently staffing their assessment of what they need, and then we're going to be pushing that out to them. But you've gone from an average of 5,000 a month to 90,000 for the month of March.
Well, and I would just say this, I keep going back to always to the same thing. Don't confuse effort with accomplishment. No matter how many people we've got to put on to be able to get these things processed and done, we need to get them done because our people are out there, they're hurting. I know they're worried about lots of different things. They're probably first and foremost worried about their health of themselves and their loved ones, but at the same time, when you're worried about paying your power bill or whatever it may be, that's an added level of stress that we don't need. And so we'll get the claims processed and everything. And I just want everybody to stay tuned and really dial into what's happening on the federal stimulus package and everything. And because there'll be dollars flowing to them in that way just as well.
Okay, thanks, Kenny. We'll go to Stephen Allen Adams next with Ogden.
Yeah, this is Steve Adams with Ogden Newspapers, and I want to piggyback on Brad McElhenney's question a little bit and drill down a little bit further. So this is either for the governor or Brian Abraham or Attorney General Patrick Morrisey. I know through state code, through the governor's emergency powers, he has the power to suspend statutory regulations and agency rules and things of that nature. It doesn't mention anything about state code, but I know further down it does give some broad authority in regards to the governor in regards to doing something similar to this. So what are we using specifically to justify being able to move this election date? Thank you.
Absolutely. So I think through the governor's declaration, he's citing a couple different areas. Most importantly, the governor has broad authority to protect the public health within that declaration. And he's made a determination that to maximize the benefit for public health, and this makes a lot of sense, that you need to change the date of the election. There are a number of authorities the governor has in terms of waiving those regulatory statutes, but also some of his quarantine authorities, and there are other sections of that declaration and the emergency powers that provides him with that authority. I think the key principle here, though, is that the governor is taking actions to defend a constitutional right. So there are a lot of competing issues at stake here, but the action is designed to maximize the number of people who are going to go out and vote, and that's very defensible.
Okay, thank you. We'll go next to Amanda Barron with WSAZ.
Hi there, Amanda Barron from WSAZ. I know you mentioned that May 12th would not be a safe time for people to go to the polls, hence the move for the primary election. I want to go back to schools. Is there a deadline that you're setting to say this is when we'll make a decision on whether or not we finish out the school year at home or in the classroom? And what kind of plans are being made to continue that distance learning?
Amanda, we're not setting a deadline as of this time, but we're very, very hopeful to be able to go back, period. Secretary Birch and I, the Superintendent Birch, rather, and I have been in constant contact with one another. They're doing amazing work. I mean, really and truly, there's so many teachers that are working online. There's so many teachers, that are reaching out and doing so many different really good things. We're feeding all of our kids. I mean, they're doing incredible work. And under really adverse conditions. And there's a lot of people, private sector that have really stepped up, and we thank them for all the help that they've been providing as well. But I would say just this, that we've got plenty of time to continue to be hopeful that we're going to get our kids back in school, and we're going to get our kids back in school for several weeks and bring closure to a school year that was really, really tough, and we're really hopeful that we're going to be able to do that. But right now, all I want to do is coincide with what our president has done in extending out to April the 30th.
Okay, thank you, Amanda. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Governor?
Yeah, we got you.
Okay. Since the sales tax and personal income tax tend to be past-looking, what are your projections or estimates for April revenue when the fact of stay-at-home will really start to impact the revenue collections?
Well, Phil, to be perfectly honest, you know, I've not gone over those with Secretary Hardy, you know, as far as drilling down to the impact of what's happening with, you know, moving, you know, our state income tax deadline till July 15th. The bottom line of the whole thing is just this, is there within the stimulus packages, there are surely significant dollars that will be flowing to the states. Now, how they flow and everything, you know, can they bridge us into the next fiscal year, and how are we going to account for all that, and how is the state going to stay above water without dipping into the rainy day fund? They may very well have to in order to bridge, you know, the income tax coming in July versus the income tax coming in April. I'll promise you that Secretary Hardy and all of his people are working on it really hard, and right now, I feel confident that what's going to happen is there's going to be enough backstop coming from the federal government, from the federal side, to backstop us and bridge us without any significant harm.
Okay, thanks, Phil. Up next, Annie Moore with WVVA.
Hi, Governor. It's Amy with WVVA. We're still hearing from nurses who are experiencing a shortage of the N95 mask. How are efforts to secure more ahead of a possible surge?
Okay, now, I didn't get it. I couldn't hear.
Okay, we're still hearing from nurses who are saying you have a shortage of N95 masks. How are efforts to secure more ahead of a possible surge?
Yeah, I got it now. I'm gonna pass this to our general primarily, or to Dr. Marsh or any of the healthcare team. But trust me, there are so many ways that we're going to secure additional masks. You know, and maybe they can elaborate on it, or all types of additional protective supplies. But they can elaborate on it better. And I think you'll find when you hear what they have to say, it'll be really substantial.
So, Governor, I can take that one if you'd like. So we have an acquisition team that was stood up at the direction of the governor at the beginning of this event. They continue to source globally from suppliers related to everything that's available worldwide. In addition to that, we receive supplies from the national stockpile. As I mentioned earlier today, supplies are going out to 55 counties from the stockpile. I think it's important to understand that this is a global pandemic. Therefore, there is a worldwide shortage of these types of PPE. So we have to work creatively. In addition to that, later in the week, you'll hear about some innovative things that are being done by a variety of partners here in West Virginia to produce our own PPE going forward in light of the concerns that we have with the availability worldwide. The other thing that we are doing is we're using our State Fusion Center to vet potential vendors, because there are some cases out there already of knockoff or non-appropriate produced PPE that some other states have experienced.
This is Clay, too. If I could just add a couple of things to the question. So it's clear today that the N95 masks are really important when you're doing procedures, or when you're with somebody you're very close to somebody who's actively coughing or producing droplets. But that the way this virus spreads is much more droplet generated than it is aerosolized. At least I think that's the thinking of most everyone. And the experience in China, after they got through the first wave where a lot of people got sick, healthcare workers got sick, the second wave is they use surgical masks, gloves, gowns, they clean surfaces regularly in their hospital areas, emergency rooms, and others. They separated people that were sick quickly, and they did case contact studies on people. They tested people, and if you were positive, they did quick case contacts. and they both drop the incidence of the infection in the population. But importantly, the healthcare workers there did not get sick. So we are trying to work as well. The general and his team are doing an outstanding job in trying to acquire more PPE, personal protective equipment for the people working. We're also trying to come up with agreed upon rules that then start to help all of us in the state understand what kind of mask is important. And it's clear today that the N95s are not needed in most of the healthcare interface experiences between healthcare workers and patients, but masks are really important. Probably in large part because we are infecting ourselves with the virus. We've talked about hand to mouth or nose, and that gets covered up. So it's an important question, and we are working on both the supply side of it and also the appropriate usage of the personal protective equipment.
Okay, thank you. Time for one more question. We'll go to David Beard with the Dominion Post.
Hi, David Beard, Dominion Post. I want to follow up on what you said about working out details of the election with like a two-pronged question. One is, do you have any sense at the moment when you'll have revised dates for early voting and revised deadlines for absentee? And then the second prong is school board elections will also be extended. So are there any impacts that you anticipate from that?
Let me do the first part. You know, what we're going to try to do, or we're going to do, is we're going to proportionately extend. So we're going 27 or 28 days, and we're going to proportionally extend, you know, the applications going out and the absentees and all that kind of stuff. And I'll pass to Mac, and you can follow that.
Right. Just as the governor said, all those dates are just going to slide to the right. All those will be posted on our website shortly, if not already. And it's just a math calculation, but I can't cite those right off the top of my head, but just watch our website. We'll get that information out very shortly.
Okay, Governor, back to you.
Well, I'm going to let me just touch on just a couple of things. We know about schools. We know about the elections, or the election. You know, we know where we stand in listening to our healthcare experts. You know that we're still trending as an average close to that 4% level, and we need to stay there, and we need to stay this course in every way. You're probably sick and tired of hearing me say that, but please take heed, because it's so important. You know, you just can't fathom the power that you have in your own hands, and so please take heed. Remember our census, and to always everybody to be counted, and I guess the last thing I'll do is just say, you know about our schools in regard to us extending to April the 30th. Everyone that I talk with in the school system and everything is doing a great job. And the other thing is, we want to absolutely commend all those people that are getting the food out to the kids, you know, that are in such need. I mean, for crying out loud, these kids are so dependent upon the school system to be able to have a good meal or a good couple of meals a day. And so that's really important. And I guess the last thing I'll do is I'll pass on to these two great people that are up here. They've done a great job, and I commend them in every way. It's a tough situation, guys. I mean, that's all there is to it. To extend an election date, you know, nobody wanted to do that and everything. Not any of the three of us, but it has to be done. And I'll let Mac and then Patrick close. So, Mac.
Thank you, Governor. Just want to revisit real quickly. People understand that the early voting process that was supposed to have started April 29th was overlapping with the president's extension of just a couple days ago. So he said until April 30th. So if we continued down the path we had, we here in West Virginia would have been in contravention to the President of the United States directive. And so then I go to Dr. Clay Marsh, and his written advice to the governor was, do not hold this election on May 12th. So again, you put those efforts together, and that's why it's real clear that this is the proper decision to move forward with shifting this to the right. A couple of questions there asking about the specifics. Use your trusted sources, and those trusted sources are the West Virginia Secretary of State's website, and in the elections arena, it's govotewv.com. Govotewv.com. We will get the most current up-to-date information there, as well as your county clerks. And one more shout out to the county clerks. They are doing a fabulous job with all the, it is a fluid situation, as the governor said at the beginning of this. It is fluid, and things may still change. So I want you to not rely on social media. Rely on the trusted sources of your county clerks, specific information to your area, as well as the West Virginia Secretary of State's website, Go Vote WV. Thank you.
Thank you, Brad.
And just to add a couple of final points, first on the elections, I think everyone has to take into account that the goal here is to maximize voter participation. If you have an election and no one shows up, that's not worth very much. It's critical that everyone take advantage of their constitutional right to vote, and I think all of us are very hopeful, both with the expansion on the absentee side and the change in date in light of the very severe public health concerns, that we could see a much higher turnout than what you would otherwise see on May 12th. Now, in terms of some other quick announcements, yesterday our office announced, along with the U.S. Attorney in the Northern District and the Southern District, that we have a consumer fraud task force relating to coronavirus issues. I think this is a phenomenal partnership because it's going to build on a lot of the wonderful work that our Consumer Protection Division is involved in. We've dealt with over 250 complaints coming into our Consumer Division, but as many people know, our office has some limits in terms of its criminal authority. By partnering with the U.S. Attorney in the North and the South, we think we're going to send a message that fraud is not going to be allowed in West Virginia. We're going to have a very tough enforcement regime, not only on price gouging, but also in terms of consumer scams or other violations of the law. The final point that I want to raise is that our office has received a number of questions related to the governor's declaration. Yesterday, the governor announced that there would be a prohibition on elective procedures. I think the rationale behind this is to obviously conserve as many supplies as possible, to make sure that the protective equipment is available for the healthcare workers who truly need it, to have access to ventilators. There are many important reasons for that to protect the public health. This declaration is broad-based. It applies to all facilities. We've had some questions. Yes, it also applies to abortion facilities as well, but it's a broad-based prohibition, and obviously we're going to continue to work with people to make sure that the governor's declaration gets enforced. So I wanted to mention those points. These are issues that have been coming up in our office. Feel free to reach out to our office. We're around the clock, and also call our Consumer Protection Hotline at 1-800-368-8808. Thank you. Thank you, Governor.
Thank you. And let me make one last point. Again, a special thanks to our Attorney General and our Secretary of State. And I would like to add just one thing. You know, the soldiers that are on the front lines in regard to our elections are no question our county clerks. And really, they're doing an incredible job thus far. And it's just going to get tougher and tougher. So think about them in every way, and we just commend them. And the last of the last is we just want everyone to have a real opportunity to be able to get to the polls and to vote, whether it be absentee or going to the polls. It is so important